Welcome to the Gluten-Free Psychiatry Podcast. This is episode 15, Polypharmacy in Mainstream Medicine. Hi, I'm your host, Dr. Daniel Williams. The reference for today comes from a chart I made in one of these handbooks. I made a handbook at an urgent care for psychiatric problems. So, psychiatric walk-in clinic for urgent issues. We tried to keep a lot of people from going to the hospital, but we would send people inpatient almost daily from that place. It was a high acuity, a lot of sickness and illness there, and lots of drug stuff. We did ADHD testing, we did buprenorphine, ketamine, the Spravato sprays, which is a treatment for different things like major depressive. And so we had a lot of controlled substances. A lot of times people were already abusing things or trying to recover from things and prescribe things all at the same time. And it got very confusing on what to do. When can you prescribe something? What are the guidelines? And I was supervising nurse practitioners and physician assistants. So they would come to me, sometimes be 3 or 4 standing there in a row, presenting these patients back to back, serious patients back to back, real quick. In a psych urgent care, and I needed a reference to go to that would work for all of us so I could transparently communicate what standard treatment guidelines were for all these controlled substances and manage the risk of such a fast decision-making process when I was bombarded. It was as if I had ADHD there. If I didn't do what you asked me to do right then, people learned I would forget. So I would just see one patient at a time and work within my skill set and within my limitations. So if you were looking at the show notes for episode 15 for Polypharmacy, you would see that I've got a table 3 here where I have a screenshot out of the clinical handbook. The link to the full clinical handbook is there if you want to read that approach. But this audio and video that I'm going to create for this is going to be 2 different pieces of content just to teach it here in a different environment. You can read the original if you want. So what medicines we're talking about are benzodiazepines, buprenorphine, Spravato, and stimulants, and Vivitrol for alcohol. So we'll go through each of those 5 that can be prescribed. There's literally 7 drugs across the columns, and there's 5 rows. So 7 times 5 is 35 combinations of controlled substances. So for example, if someone drinks alcohol, if they have an alcohol dependence, if I'm a doctor and I think they're going to be drinking too much at home or they can't control it, they're unpredictable, I pretty much can't prescribe any controlled substance at all. No benzos, no buprenorphine, which is for opioid withdrawal, no Spravato, which is ketamine, nasal spray or different forms. It's injected, basically Spravato, into the body to help you with opiate withdrawal. Stimulants, why? Do you remember Dos Locos when they had a beer? It was an alcoholic beverage. I think it had liquor in it and stimulants to wake you up like caffeine. And it killed people because the stimulant will let you stay awake and drink more, and then the alcohol will kill you. So the only thing you can be prescribed on this chart if you're an alcoholic is Vivitrol, which helps alcohol cravings. So if you're not aware, if you have or know someone that has an alcohol problem, they've kind of made it detox a little painless. If you want Vivitrol, if you have cravings for alcohol, it's just like a monthly shot and you're done. It's expensive, and it does have naltrexone pills you can take. But Vivitrol has alcoholics not worried about it. They're seem to be more relaxed in the clinic. They're steady, regular, staying sober. Vivitrol does work for a lot of people. It's good stuff. All right, and then if you have a problem with benzodiazepines on this list, benzo addict, say you're already prescribed one or you're getting it off the street, doesn't matter. That's the only one on my entire table 3 here that you can't prescribe anything. Mixing benzos with anything is deadly. That's why there's X's all the way down the chart. In buprenorphine, you can't do that either. You can't prescribe anything except for stimulants. Ironically, you can get a stimulant and be on Spravato or buprenorphine pills if you're an opiate addict. It's possible if you're an opiate addict to be in recovery from that and be on a stimulant for attention deficit disorder. A lot of people don't know that. So this table is pretty helpful because you would think that we're throwing the baby out with the bath water, that any kind of addict, no controlled substances at all. And that's just not true. It's a case-by-case basis, and it's based on these specific risks. The doctor shouldn't be just against you automatically if you're an addict or in recovery. You can use an objective tool like this. So go to the show notes of episode 15, mindshiftcare.com. Look for Polypharmacy in mainstream medicine because it's all over the place. In clinics that are prescribing you 2 or 3 things on this list, you should run from them and read the side effects of why. Maybe it's temporary and you need it, it's making you feel better. But if the only way you can feel better is take a medicine that's killing your brain cells, you've got a bigger problem than what you're being prescribed. Much bigger problem. You may be on the auto-delete program where you're taking yourself out and you're using prescriptions to do it. So don't do that inadvertently. Don't take benzodiazepines, for example, if you can at all help it. And if so, make it temporary and make some real changes in your life. That's what Mindshift Care is all about, because most people get on these benzos. They're very hard to get off. We're talking about Xanax, Ativan, Klonopin, Valium, even Ambien, the sleep medicines, temazepam, and others, the Z drugs for sleep like Zaleplon. They're not exactly benzos, but they work on the GABA receptor, GABA. That is your nervous system. It's one of the sedatives. It relaxes the nervous system. So you start toying with your chemistry of your body and it's going to react. So you stop the pill or the alcohol. The benzodiazepines work just like alcohol on the same GABA receptor. And guess what? Your body's been used to something suppressing that nervous system. So now you're going to get paid back. And your nervous system is going to be on high alert as you withdraw from the benzo. Same with opiates. You mess with the body system, you're going to pay for it in a very uncomfortable withdrawal phase. Now, methamphetamine. Meth addicts don't get a lot of luck here. They also can't get any of these controlled substances except for buprenorphine. So here's another exception. It's possible to be a methamphetamine addict in recovery and get your opioid addiction treated with buprenorphine, which is a controlled substance. And it's a step up from going to the methadone clinic, but it's still kind of similar. And you're treated the same. It's hard to get these controlled substances because you have to come to appointments very often, which costs a lot to show up with copays, and the drugs themselves may or may not be available for different reasons, like on this chart. If you have an opiate addiction and you're an active addiction, Spravato may be able to help. You can still get stimulants. Sometimes, surprisingly, we would prescribe stimulants to opiate addicts on a case-by-case basis, because there were some that were managing that. Of the whole chart, that's the one that can be misleading the most, is mixing opiates. And when I don't mean an opiate addict that's out of control, but I mean someone that's struggling but doing pretty well, and maybe they're on buprenorphine or maybe they're not. Either one, whether they're on buprenorphine or not, the opiate addicts could still get stimulants prescribed. And the next category is stimulants. Stimulants being like Adderall, Ritalin, methamphetamines, things like that. Not methamphetamine, but the different mixed amphetamine salts. They're very similar. So amphetamine and methamphetamine is just one methyl group. What is a methyl group? It's a carbon and 3 hydrogens. That's it. It's almost the same thing. So a stimulant is legal speed. It's methamphetamine, but it's a slightly safer at those doses, slightly, because people can still get psychotic on this stuff, particularly if they have an undiagnosed bipolar condition. You can get manic on a stimulant, and I've seen people psychotic on this stuff. In my career, I've seen the side effects of all this, including THC psychosis that lasted 20 years after one use. Hard to know if there was another substance in it or not. But when people spend decades in a state hospital over these drugs, you have to take each one of them very seriously. So for stimulants, you can't get a benzo and you can't get Spravato, which is the ketamine, but you can get buprenorphine. So you can be, say, an addict in stimulants. You used to abuse Adderall, but you don't anymore. It's possible to get back on it if you're in recovery. It's possible to get alcohol treatment and even the ketamine if you need it for a resistant major depressive disorder. Finally, THC. Now, THC from cannabis, marijuana, it's never been shown to overdose or kill anyone in the history of mankind. And all these essential oil plants that I talk about, if you go back a few episodes and look at my homeopathy for pain, you'll get the presentation in that episode about how plants have oils in them that are medicinal, and they've been used for balms and salves and healing remedies for thousands of years. And things like lavender, eucalyptus, peppermint, clove oil. Clove itself is in oragel, so it's a numbing agent, and you put it on your teeth when your tooth hurts. These plants have medicinal properties that we use all the time. Peppermint's in our toothpaste. Citrus and lemon and orange is in our cleaning supplies when we spray it on a counter. Or Gooby Gone that takes the sticky residue off a tape. That's orange oil. You could squeeze a drop from an orange on that and do the exact same thing, because that's all it is. They've overprocessed and added a bunch of chemicals in these products, but they come from essential oils. Well, when it comes to hemp, particularly the cannabis, both indica and sativa, they have 500 different chemicals, not just one, not just lavender from the lavender plant, eucalyptus from the eucalyptus plant, peppermint from the peppermint plant. THC from cannabis has something like 200 cannabinoids that mimic the proteins in your body, called endocannabinoids, and CBD, the cannabidiol oil, CBD oil. It's used in topicals a lot. Totally helps with the immune system. I was in Colorado as a medical director and in Missouri, where recreational cannabis is legal. And I'm trained in Texas, where it's not. So that's why I'm going a little more into this, because it depends on where you're at, whether it's a disorder or not. And that's completely stupid. And it highlights the fact that the American Psychiatric Association is just a political wing for these diagnoses sometimes. They're just grouping symptoms. It's not biological. The National Institutes of Health abandoned doing research on their symptom-based diagnosis criteria. Okay? So there's a lot of flaws in the system. So if you weren't aware that cannabis can be medicinal, then you got a lot to learn. Stay tuned. So if you're on THC or doing it medically or recreational in a legal state, you can still be prescribed buprenorphine for opiate addiction and Vivitrol for alcohol addiction. But we did not give people benzos or Spravato, the ketamine, because that's a hallucinogenic, or stimulants. We didn't give stimulants to people on THC. That could have been different. It could. I didn't necessarily agree with that if someone was using cannabis recreationally and they were a responsible person that loved themselves, so they were choosing to take care of their physical, mental, spiritual, and emotional self. That's the opposite of an addict who's in a self-destructive phase, just, acting out the trauma that's been programmed in their subconscious. They haven't taken ownership of their mind, body, spirit yet to love themselves. So you show me someone that's taking care of themselves, and I would probably prescribe a stimulant for them. But that's not what it says on the chart, because that's usually not what's happening in the clinics with drug seekers. So there's a lot to consider with this. Take it with a grain of salt. But this is what I used at a very busy psych ER. You can visit mindshiftcare.com, episode 15. Download this handout I've got for the medications, particularly on benzodiazepines. Benzodiazepines, again, are like the Ativan, Klonopin, Valium, Xanax, and even the sleep drugs. You might be on Ambien or some of those like Lunesta. They kill brain cells. All of them do. And so I've got an article that was written in training, and I've modified it a little bit, but it still works. It's still true. It's killing brain cells, drops the IQ by about 9 points, and does a whole lot of other things. So if you want to see the full list of side effects that your doctor is worried about with respect to controlled substances and what you're taking, whether or not you're being honest, whether or not you can safely mix these things, we operate in the dark quite a bit. So this guide was very helpful. Just visit episode 15 of mindshiftcare.com. This has been the Gluten-Free Psychiatry Podcast.